Hey, and welcome to the Bossed Up Podcast, episode 505. I'm your host, Emily Aries, the founder and CEO of Bossed Up. And today I want to ask a provocative question. Can public policy actually encourage American women to have more babies? You may have heard this pro-natalist message from the likes of J.D. Vance, Elon Musk, and Donald Trump, who want to inspire a new American baby boom. They want American women to have more babies. My first confession of today's episode is that I weirdly agree with them. I do think our plummeting birth rate could be a really bad thing for our country and for the world, with enormous implications on things like, funding Medicare. Demographers call this population decline an inverted pyramid structure, where there are many fewer young people who are working and supporting many more elderly people who are, let's say, benefiting from things like Medicare and Medicaid, and who are not currently in the workforce. That has a lot of implications for our society, which was designed for the opposite to be true in so many different ways. The other reason I find America's declining birth rate a concern is because women themselves say that they want more kids. An article in the New York Times put it bluntly back in 2018, titled "American Women Are Having Fewer Children Than They'd Like," in which they wrote, quote, "The gap between the number of children that women say they want to have, 2.7, and the number of children they will probably actually have, 1.8, has risen to the highest level in 40 years. From 1972 to 2016, men have expressed almost exactly the same ideal fertility rates as women. In a given year, the average, just 0.04 children below what women say is ideal." So in other words, what they're saying here is that both men and women want to be having more kids than they actually are. Ask any parent right now why they're not having more kids, and you'll probably get an onslaught of economic realities, like the many topics that we've talked about on this podcast before. What comes to mind for me right now, as the mom of a 6-month-old and a 3.5-year-old, is the cost of childcare, which is skyrocketing, which will be costing my family. I've been saying on this podcast for a long time now, over 50 grand this year. I was woefully underestimating that number, which is actually coming closer to being $57,000 this year. That's wild, right? That is a huge economic burden that most people cannot justify and can't make happen. And so when we hear about the declining fertility rate, we're really talking about this gap between the number of kids people say they want to have, men and women alike, and the number of kids that we're actually having. I think that's sad. Call me crazy, but I think people who want to have kids should be able to have kids, especially in the wealthiest country on earth. Not only do I think it's sad that we can't self-actualize the families we envision for ourselves, but we're also, kind of continuing the species and all that. So I think that's really messed up, that we are not creating incentives for people to have the kids that they actually want to have. Now, let me be clear. I'm not saying we should encourage people to have kids who do not want to have kids. I am super pro-choice, more pro-choice than ever before. As a mom, the absolute life-altering decision to become a parent should not be one that is ever forced upon any person. But for those who want to have more kids, who are saying that they can't or they won't, or that it's just not in the cards for them, I think that's a failure of our society. And that it says something about what our society does and doesn't value. It values you as a consumer. It values you as a worker. And it doesn't really value you as a parent. It doesn't really value kids, especially young kids. And so that's left us with what I consider to be a national crisis on our hands. And I don't want that national crisis, this plummeting birth rate, to be somehow co-opted by the GOP and the right wing alone, because folks across the aisle care about this issue. But as Chappell Rowan recently put it in a Call Her Daddy episode interview that went viral and earned her a lot of quite frankly, she got a lot of flack about this. She talked about her friends who have kids and said that they are in, quote, hell And here's the thing. She's not wrong, right? Love or hate her, which by the way, I love her and I think her music is great. And Max, my 3.5-year-old, particularly loves Pink Pony Club. The Surgeon General put out a report last year I covered on this very podcast that reinforces what she's saying. America's parents are experiencing a absolute mental health crisis. And so you look into the causes of that mental health crisis and you see a society that does not make it easy to have kids. So what's being done about this? Well, just the other week, Donald Trump floated the idea of a $5,000 one-time baby bonus, which earned a lot of derision from the liberal circles that I tend to run in. But from my standpoint, I think this is a very interesting development. Not because I think this is a good idea necessarily, but in what world are we living in that a conservative president is talking about government handouts to moms? That's really interesting because that has historically been antithetical to the GOP and to more conservative thought leaders, These are the same folks who railed against welfare queens as this barely veiled racist critique of women who are having children to get more government benefits, right? That's historically been a huge critique from conservatives. So the fact that Donald Trump is explicitly floating this government handout concept is really interesting to me. Now, do I think $5,000 is sufficient? Hell no. But perhaps this is a starting point for a broader conversation that we can actually have in this political moment. I mean, the fact of the matter is that we have broad bipartisan agreement that having kids is too hard to do in our country right now. And even for folks who don't have kids and who don't want to have kids, I think they can acknowledge, like the chaperones of the world, that their friends who are having kids don't really make it look appealing either. So there are lots of family-friendly policies that have been discussed and floated. Most of these, by the way, are being promoted by Democrats and liberals that include things like paid family and medical leave for all workers, both men and women, whether you're leaving to take care of your elderly mother or the arrival of a new child, right? Or yourself. Paid family and medical leave covers all of that. Affordable childcare. Don't get me on my soapbox. I've got enough episodes about that issue already. Affordable access to high quality prenatal care, especially for Black women and women of color in this country whose maternal mortality rates should be a national embarrassment for us. And then the things that are more kitchen table issues like affordable housing. How can you have more kids if you don't know where to put them? How about working hours that match school hours? How about year-round schooling? Because what the hell is a working parent supposed to do in the summer break? And how about something like gun control? I know a lot of folks, a lot of parents across the political aisle who feel afraid to send their kids to school in our country for obvious reasons related to gun violence. The list goes on. And all of these public policies are good thought experiments. These are good ways that certain states can move forward in experimenting with making family-friendly policies the law of the land. One idea that I don't think gets enough attention, and I really want to advocate for and elevate, is the idea of paying stay-at-home parents. If we pair this policy, paying stay-at-home parents from birth to 5, with affordable access to high-quality, funded early childhood education and early childhood care, daycare, I believe this would create a true pro-choice environment to navigating those first critical years of a child's life. Right now, that age group, 0 to 5, just falls into a societal chasm where we don't even really acknowledge in any particular infrastructure that they exist. And our entire economy has been running on the backs of stay-at-home parents and stay-at-home moms in particular who tend to exit the workforce to care for kids during that really critical time period until the age of 5, when all of a sudden our society deems them notable enough to have some place to put them. Kindergarten, right? Now, that has created a huge mental health crisis among parents because a lot of parents don't want to stay at home full time. Maybe early childhood development isn't for them, isn't their passion, isn't their first choice, but it is the choice they have to make due to financial necessity. That's not good for parents. That's not good for kids, right? The data on whether your kid is better off in daycare or staying at home with a parent is very clear. It depends on what makes that parent happier. A depressed stay-at-home mom is not better than a not depressed daycare provider, right? So it's not you being the sole provider of care for your child. It's about the person who's providing care for your child not being clinically depressed that matters, right? And so if we create a society where men and women can really access that choice without financial constraint, whether they want to stay home during those early years or not, I think that would make for a much more equitable society. Now, some people, feminist scholars in particular, worry that only women, or very much mostly women, would take advantage of this opportunity, and that would, cause a backsliding of women's achievements in the workplace. I'm left wondering, like, who are we to judge? If women want to take time off to stay at home as a full-time parent, as a feminist, I think that should be women's free, unrestrained choice to do so. I think we should make sure that the workplace is accommodating for on-ramping back into the workforce, and that we can make systemic changes to how our workplaces work to make that possible. Workplaces should also be accommodating for working parents, whether they're male or female. And yes, I want women to consider the impact on their careers and lifetime earnings that taking a 5-year career break could have. But I also want men who have careers to feel like if they choose to be there for their kids during that critical time in that way, if they feel called to be a stay-at-home parent, they should be able to access that option without long-term negative ramifications on their careers too. I think that's good for both men and women. Now, I would think that this would be a wildly popular policy. It's not a cheap one. That's another part of this. It would be a very expensive policy. But I haven't really seen most people talk about it. And interestingly, I was reminded that back in 2019, there was a policy introduced in Congress, the American Family Act of 2019. It was sponsored actually by Colorado's own Senator Michael Bennet, who, interestingly enough, just announced that he's running for governor here. So maybe this is his chance to make Colorado the best state in the nation for being a parent. We'll see. But Democrats, including everyone from Bernie Sanders to Kamala Harris, co-sponsored this legislation. And among the many things that it adjusted, it offered $300 a month per child for parents who stay home to care for those children up to the age of 5. Essentially, what they did is they took the child tax credit, and instead of giving you that couple $1,000s off your taxes at the end of the year, they turned it into an upfront monthly payment, not just an end-of-year credit. There was a really interesting article written about it at the time, again in the New York Times, called "Stay-at-Home Parents Work Hard. Should They Be Paid?" And Andrew Yang, one of the many Democrats who was running for president at the time, said this, quote, "The question is, what do we mean by work?" Andrew Yang said on The Daily last month, and gave as an example his wife, who stays at home with their sons. Quote, "I know my wife is working harder than I am, and I'm running for president. And right now, the market values her work at 0. So we have to think bigger about what we mean by work and value." And I completely agree. I don't think $300 a month per child comes close to actually valuing the labor that stay-at-home parents provide. But whether I hire someone to care for my children, like I do, happily, by the way, or I choose to stay at home myself, I would want that labor to be valued in real dollars. Now, look, there is some precedent for this. Many state Medicaid programs will pay family caregivers to care for their elderly, aging parents or siblings or whomever that you're related to directly. In Colorado, I looked it up. They will pay caregivers up to $27.50 a month from Medicaid to provide elder care. So we value caring for an old person at about $27.50 a month. And yet, the most radical proposal I've seen in Congress for the same care for a 0-year-old, for a 1-year-old or 2-year-old or 3-year-old or 4-year-old is tapped out at $300 a month. That's bullshit, in my opinion. I think we know that caring for an elderly family member, or caring for the nation's youngest and most vulnerable population, that caregiving work is hard and should be valued at the very least up to $27.50 a month. But I can hear the critics already saying, Emily, why should I pay for your childcare? You chose to have them. So why should I pay you to stay at home as a parent, or why should I pay for your provider of childcare? I hear that argument and I get it. Here's what I would ask in response. We already pay collectively to educate and care for 5-year-olds in this country, right? Once they become kindergartners, we've already collectively decided we should probably care about the future citizens of our nation. So what's different about a 4-year-old than a 5-year-old? Exactly. I mean, I know early childhood development specialists would have a lot to say about that, but why do we care about kids when they turn 5 and decide that we should have a safe haven for them in the form of public kindergarten? And we just don't care about 0 to 5? They just fall into this societal chasm where they're completely unaccounted for because we have been running our entire society banking on some family member, more often than not moms, caring for those 0 to 5-year-olds. And that's a huge liability. It's a liability undergirding our entire workforce and our entire society. Nothing in our world works without providing care for kids at these earliest ages in their life. And nothing about our world can continue if we stop having kids because we've deemed that labor, providing that labor for free is just too impossible. And that, being able to live off a single person's salary, or if God forbid you're a single parent, leaves you feeling like you're in an absolutely impossible situation. So to me, this is a truly existential question. If you care about the continuation of our species, of our country, of your fellow countrymen and women, we should all invest in children. They are, as cliche as it sounds, our future. And so, to be clear, supporting parents in this pursuit should not be a punishment for non-parents. I'm not saying we should ask non-parents and people who have no interest in parenting to somehow shoulder the burden for the rest of us. I'm saying we all should make removing barriers to having the families that people want to have possible so that all of us can achieve our full potential. And shout out to the aunties and the uncles out there who are taking awesome vacations and traveling and like doing all the cool things with their disposable income that parents are unable to do because we're spending all that money on childcare or diapers or what have you. I'm not judging that. And I don't think that should be a right that anyone has access to luxury. I'm saying we should have a right to have access to having the kids you want to have without going completely bankrupt along the way. Now, here's the unfortunate reality of the situation. Even if we do all of this, which is a big if, because God knows the political will to pass paid family and medical leave alone has not been there in Congress. But even if every policy I just described is implemented, the birth rate might just be doomed, as everyone tends to turn towards Sweden, known as it being extraordinarily equal, where, quote, family-friendly public policies are especially effective, end quote. We've seen sort of egalitarian values on the national level and more progressive family-friendly policies passed there for decades now. We just haven't seen the birth rate decline reverse. According to some of the most recent fertility statistics coming out of Sweden, this causal relationship between family-friendly public policy and the birth rate is very much under question. Quote, Swedish births for 2023 will settle at their lowest level in 2 decades, while the country's annual fertility rate, the number of births per 1,000 women aged 15 to 49, will likely set an all-time record low. They go on to write that since 2021, the number of births in Sweden are down more than 12%. The fertility rate has fallen almost 14%. Now, there's a lot of demographers who would emphasize the fact that the United States and Sweden have very little in common demographically, starting first with the fact that we are so much bigger. And I'm left wondering, is there anything we can do to reverse the tides? There's a lot of people who say, oh, the cultural narratives are already in place where people who don't want to have kids aren't having kids. I don't think we need to persuade anyone to have kids who doesn't want to have kids to improve our birth rate and our fertility rate. All we need to do is enable the people who do want to have kids to have the number of kids they actually want to have. That's the gap I think that public policy can help to close. But it is a hypothesis. We're not experimenting nearly enough to even test that hypothesis right now. So perhaps this is a moment where there will be federal leadership, or at least an appetite for some new federal conversations nationwide about how America can spur its birth rate along. And hopefully we can have those conversations without it turning into something about eugenics and white supremacy, as the quote pronatalist movement has tended to do in recent months and years. But if we can simply have a conversation about why it is so hard to have the kids you want to have, if you want to have them in this country right now, I think that could be a very fruitful discussion for our federal leaders. And in the absence of Congress's ability to get much of anything done these days, I will look to the state level. And I really would challenge folks like Senator Bennett here in Colorado, if he were to become governor, to ask themselves, how can my state become the most family-friendly state in the nation? I know Tim Walz really asked himself that question in Minnesota and has been making strides to make that possible. The fact of the matter is we have a lot of room for improvement when it comes to making America a great place to have kids again. maybe that's the slogan that could bring folks together if you're going to go that way. You know what I mean? I do think a lot of folks on both sides of the political aisle care about this issue. Jojo, my 6-month-old, who's currently sitting on my lap, certainly does. I want to hear what you make of today's podcast. So let's keep the conversation going, as always, in the Bossed Up Courage community on Facebook or in the Bossed Up group on LinkedIn. You can find today's corresponding blog post and fully written out transcript at bossedup.org/episode 505. That's bossedup.org/episode 505. Until next time, let's keep bossin' in pursuit of our purpose. And together, let's lift as we climb.